The advice and opinions expressed by Dr. 𝗂𝗓𝗃𝗃 and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen 𝗂𝗂𝗃𝗃 is
Dr. Doreen is an expert in autism.
Doreen 𝗂𝗂𝗃𝗃.
Dr. 𝗂𝗂𝗃𝗃.
Dr. Doreen 𝗂𝗂𝗃𝗃.
Dr. Doreen 𝗂𝗂𝗃𝗃 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. I want to get to the question that we had at the beginning of the show that I said, let's put a pin in that for a second. R wanted to know about the sensory overload, the things, their 5-year-old was afraid of fireworks or noises bothering her, was not afraid of them until a few months ago. Is this normal? She started plugging her ears when she hears the blender as well.
Yep.
Do kids on the spectrum have extra sensitive hearing, and is this just discomforting for them, or does it physically pain them?
You know, I don't know if it causes what level of discomfort it causes. It definitely does cause some discomfort, but think of it in this way. Like I've had, oh my gosh, so many kids over the years. I go back into my youth, right? When I was a young therapist in my early teens. I mean, I started doing therapy when I was 16. So I remember incredible things with kids where, like, you know, they would stop what they were doing and run to the window, this little boy, and just sit at the window until the garbage truck came and passed. And that was something that I don't know if it was causing him pain or just interest, but he could hear it a minute before the rest of us. Like, nobody knew, but after a while we figured out it's the garbage truck, you know, and he loves hearing that. So, and then over the years, I mean, oh my gosh, not only have I seen things like that 1,000 times, but some of my very, very high functioning or recovered individuals have actually said to me that other sounds were much, much, much louder than the sound of language, which is amazing. Because if you think about it, we focus on certain things that are, I guess, not. We have sounds that we consider to be background noise and other sounds that we consider to be foreground things to pay attention to. And in like typical development, language is one of the things that is in the foreground. It's supposed to be paid attention to, right? But with our kids, like a couple of my kids told me, like, it was really hard. It was background noise for them. And they had to train themselves to not pay attention to those sounds that were louder and more acute, I guess, and to pay attention to what they considered to be background noise, which was language.
Yeah.
And that's how they started to really learn and pick up. But they had to focus on it. And so that's kind of interesting. Like, as I get older, I realized, and this happened last night, actually, I was telling my husband, because we were watching something on TV, and when you're younger, you're pretty good at multitasking in the sense that you can talk to someone and actually somewhat hear what's going on. At my age, you cannot do that. Let me just say. And like, I either have to stop this or not listen, like one or the other. I can't do both. And that's just the way it is. When my kids are around, they all do that, right? And there's a third stimulus too. They're like this, they're listening to that, talking. It's insane. I don't know how they do it. So to some extent, that's, I think, what kids with autism or individuals with autism also experience, is just overload of input of sensory stuff. And they have to learn over time which ones are the important ones and which ones they have to put in the background. Clearly certain things are disturbing to them, like lights in particular. Certain lights, I have seen children who are just like this, so I know it's disturbing to them, but more than, I mean, rather than think of it as pain, I think I would say it's just overwhelming, because they have, there's no filter. They don't, I think for some children, there's just too many things coming at them in a very raw form. Imagine if you, let's say, had loudspeakers on, right? So sounds might be louder. The lights are more intense, things like that. And there's just so many of them, sounds that we are very good at just putting in the background, I think they have a hard time with that. And so there's just too much coming in.
Yeah.
But they learn. They overcome, most children overcome that. And by the way, before they overcome that, you should help them. So when you're in environments that are going to be very noisy, you can give your child a sound, headphones that are reduce the sound. Or you can give them glasses, sunglasses, tinted glasses. You could teach them to go to calmer areas. I mean, there's a lot of things we can do to help our kids with that overwhelming sensory input.
And we gave you a list of 10 of them on yesterday's show.
Perfect,
so there you
perfect,
go. And it included glasses and headphones. We're not going to get to all of these questions, and I did promise, but I do want to say hi to Sarah and Huma. I did promise Marina that we would cover this question that came in on the website.
Oh.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.